Yes, Mr. Chair.
You know, you cannot blame me if I expect, faster answers. Kasi circular ninyo to eh. Ako, 2-3 araw ko lang nabasa ito eh. But I can commit them into memory if I want to.
It was signed by our president then on August 5, Mr. Chair.
Yeah, that is correct. And in this circular, it says that it should be reviewed every 6 months. Is that correct?
Yes, Mr. Chair.
Every 6 months. Positive, okay? Yes?
Yes, Mr. Chair.
Okay. On October 29, 2013, Philhealth issued circular number 0031, series of 2013, to implement an all-case rate policy. Correct?
Yes, Mr. Chair.
Correct?
Yes, Mr. Chair.
Okay. The objectives are as follows. Reduce claim processing or time turnaround TAT. Increase Philhealth support value. Rationalize reimbursement rates. And achieve technical efficiency for providers. Okay. Isa-isahin natin, Dr. Pargas. Achieve technical efficiency for providers. Did we achieve this?
Yes, Mr. Chair.
How can you say that? Technical efficiency for self-providers. Katakot-takot na audit observation memo. Inulang kayo ng napakaraming notice of disallowances concerning the payments to these hospitals and care capacity. Pagkatapos sasabihin mo, how could you even say that? Achieve technical efficiency for providers. Rationalize reimbursement rates. Okay. Have we rationalized reimbursement rates? Have we? Tinanong nga kita nung isang araw eh. What will happen to the excess payment given to the hospital? Sabi mo, sa hospital na lang yun. Is that the way you rationalize reimbursements, Dr. Pargas? Ang kanyang intervention is only 10,000 pesos. Binayaran mo siya ng 15,000 pesos. Yung 5,000 napunta sa hospital. That is rationalization. That is rationalization.
Mr. Chair, with regard to the one, ang prinsipyo po kasi nung case rate really is, dahil fixed po siya, meron po talagang mga kaso na maaaring mas mataas ang nagagastos,
Alam
pero
na
maaari
natin
po
yun,
mas
Dr.
mababa.
Pargas. We've been there. Ulit-ulit na tayo dyan. But the system is bad. It is not correct because it is not a system where you were able to get back the excess fund para magamit uli ng PhilHealth. That is the most ideal thing to do. You remember the bus conductor or the bus inspector? I've been telling you. You
Yes,
remember
Mr.
the inspector in the trains?
Yes, Mr.
Ganon
Chair.
dapat yun eh. So wala talagang malasakit eh.
Dr. Pargas, I'm sorry to say, pero ang audit report nyo, since that time, parating negative. Wala kayong naging auditing report na positive.
Precisely. Kaya nga itong mga objectives na ito na binabasa, walang natupad dito eh. Example, paano mo na-reduce yung claim processing? Dahil mabilis kang magbayad. Siyempre, wala na eh. Kahit na ba sumobra pa ng 10,000 ito eh. Ano naman ang pakinin nyo? Hindi talaga, ang lumilitaw dito sa pagsusuri namin dito, pag yung pag-alaga, yung pagsinop doon sa pondo, wala kayong pakialam doon eh. Yung pag-disburse, yung pag-spend, yun ang mabilis. Tingnan na lamang natin, Mr. Chair. Ang pagkakaalam ko, the number 2 killers, mortality, na pumapatay sa tao, sa ngayon, number 1, heart diseases. Number 2, vascular diseases. Number 3, malignant neoplasma. Ito yung cancer. Bakit ang nangyari, Dr. Pargas, ang tatlong yung top ninyo na ailments na binabayaran under all case rate, pneumonia, gastroenteritis, and UTI. What happened to the 3 topmost killers in this country? Did you ever think about this? Did you adopt a study? Mukhang talagang walang pag-aaral dito. Somebody have been telling me na ito po talagang minadali. Ito walang... Now we are able to confirm all this. Even by way of your answers, you are not able to reply to us with certainty, with conviction, and in all honesty, I am frustrated with the answers that you are giving us. Ang gusto ko lang kaya ako nagpunta rito, Mr. Chair, I wanted to see that Attorney Del Rosario. I want to tell him in his face how frustrated I am in giving me all these answers, these silly answers. Alam po ba ninyo, Dr. Pargas, alam ko nagre-research din ako, maski mahirap Ang daming adverse COA findings sa inyo. For example, less than a year after the ACR was implemented, na-implement kasi you started with 23, so 2011, less than a year after the ACR implementation, Philhealth suffered financial bleeding. Ang dami, it was triggered by spate
Overpayment.
notice of disallowances. Ang dami. Let me cite examples. Region 5, Dr. Pargas. Notice of disallowance dated September 12. 2,273,000, blah, blah, blah. Audit observation memo, PCH. Philhealth is not protecting. Ito yung observation mismo Ang sakit nito Philhealth is not protecting the interests of its members and instead benefiting the institutional healthcare providers. Baligtad Ito yung observation ng... I'm not sure if
Honorable Marcoleta, with apologies, can you wrap up?
I am trying, Mr. Chair. But I think you will have to forgive me if I continue.
I continuously forgive you,
Thank you.
Honorable Marcoleta.
Region 12, audit observation memo, questioning the validity of benefits claims payment of 4.6 million due to lack of statement of accounts from HCIs. Region 2, notice of disallowance dated August 31, 2018, disallowed the overpayment of 56 million. NCR, various notice of disallowances disallowing the payments of some 54 million pesos. Not only that, Mr. Chair, not only the adverse findings of the COA, ito mga independent studies ito, Dr. Pargas, I will cite several of them. In November 2016, a paper entitled 2016 Health Finance Policy Sector Report Rationalizing Case Rates was presented to the Philhealth Board. You recall this, Mr. Pargas?
No, Mr. Chair, just to clarify, in 2012 po, I was in corporate communications. 2013 to mid-2018, I am with the corporate affairs. Ako po ay napunta lang sa health finance noon pong mid of 2018 as an OIC and was appointed as Senior Vice President ng Health Finance noong 2019.
What are you saying? You don't know about this paper?
When it was presented po, I was not there during that time. So
The question is, do you know? And you came to know about this paper? Yun lang. Yun lang ang tanong.
Then, Mr. Chair, yung title, sorry po, apologies po, yung title lang po.
Ito nga, 2016 Health Finance Policy Sector Report Rationalizing Case Rates. Importante ito because these are independent studies commenting and trying to help you determine the weaknesses of the system. This is on record. This is on record.
Yes
you know
po.
this?
I think I've heard
Okay.
naman po.
Yun
Yes.
lang naman
Yes po.
Okay. This report, Dr. Pargas, for your elementary education, showed that the fee for service, ito yung dati, this is the old system na pinalitan ng all case rates. The FFS payment schemes average value per claim did not exceed 5,000. So yung old system ninyo, yung average value per claim did not even exceed 5,000 pesos. Ito yung sinasabi ng report. Itong all case rate, all case rate posted an increase of 44.9% average increase in payment to level 1 hospitals. Is this correct?
Yes, Mr.
Okay,
Chair.
yes. This report also further showed that despite a 9% decrease in the number of claims in level 1 hospitals, nag-decrease ng 9% yung claims ng level 1 hospitals, but the amount paid to them increased by 65% nung gamitin na ninyo ang ACR system. Ito yung lumabas sa study. Okay. The same report, Mr. Chair, disclosed also that an overpayment in more than 1/4 of the total claims, 1/4 ng total claims in 2016 ay nandoon. And it resulted in overpayment of about 2.6 billion pesos for the same year. Ito yung sinabi ng study. Okay? Ito pa. Also, in November 2016, in Davao City, merong in-house actuary na nag-present ng report entitled, this is the title of the report, Towards NHIP. Ito yata yung National Health Insurance Program. Sustainability, fiscal year 2016 to 2025. It was presented at the Philhealth Regional Consultative Meeting. You know about this?
I would recall,
Okay.
Mr. Chair.
So ang ang factual lang talagang, it did happen talaga. There was a paper presented in such a gathering, right?
I would suppose so, Mr. Chair.
Okay. This report, Dr. Pargas, warned PhilHealth that the NHIP fund operated at a net loss for fiscal year 2011, 2012, 2013, and 2015. Okay? Yun ang report. Winarn kayo na you were on a operating loss. This report also projected that the fund would be depleted by 2019 because the expected operating expense was estimated at 140 billion or a deficit of 140 billion. Ang estimated collection nyo lang naman ninyo, 110 billion. So you have a deficit of 10 billion.
Honorable Marcoleta, mukha naman pong agree naman po si SP Pargas sa lahat ng mga binanggit ninyo at tama po yung inyong mga pinunto. I'll give you time to wrap up, and the next is the Honorable Rimulya. Sa likod nyo lang po ang kagalang-galang boy Rimulya.
Yes, sir, pero ito namang si Congressman Rimulya kasi kaibigan ko naman ito talaga. Pagpapasensyahan ako nito. Isa na lang kasi pong...
Sige po, Honorable Marcoleta.
Dr. Pargas, in 2018, mas importante itong mga independent studies na ito eh. A 2018 World Bank paper entitled Striving for Equity and Efficiency, an assessment of provider payment reforms in the Philippine health sector. Meron din ito. This World Bank paper recommended the revision. Tandaan po ninyo, kung wala po kayo nito, dapat naman meron kayo. This World Bank paper recommended the revision of the ACR payment mechanism, noting that case rates fix the amount that providers receive in advance and eliminate the option of uncontrolled balance billing in public and private hospitals. Ito yung dapat ninyong makita. It further noted that when PhilHealth switched to case rate payments, it failed to put in place a cost control mechanism. Ito yung pinakamabigat. Kaya ang sabi nga natin, talagang gatasang baka na nga. Ito, tatagalog ko yung isa para mas matindi. Sabi pa nito, ang dalawang pinaka-importanting aspeto ng polisiya ng ACR or all case rate, maganyak ang tagabigay ng serbisyo na maging technically efficient at maprotektahan ang mga pasyente sa mga panganib na pampinansyal na hindi matutupad sa paraan ng pagkakadisenyo ng ACR policy. Ang konklusyon, mismong request na gawin para sa PhilHealth at DOH, at ang payo kay DOH ganito, the fundamental shortcoming in the way the case rate payment mechanism has been implemented is exactly the same as the PFFS. Ito yung nakaraan. With the ACR payment serving merely as a discount off the hospital service charge. Napakasakit po na ito. Pero ito, these are all, I'd say, mga guidelines na binigay sa inyo, pambukas isip sa inyo, pero balikan na kita, tuhuli na po ito sapagkat marami pa akong itatanong, pero second round na lang ako. The last hearing, Dr. Pargas, sabi mo sa akin, sa lahat ng nangyayaring ganito, the structural deficiency in the system of collecting the balances, kung meron man, sabi ko, pinag-aralan mo ba? Ang sabi mo sa akin, aaralin nyo pa lang. Paano nangyari yon? Yung inyong policy, dapat every 6 months inaaralan nyo. The independent studies, sinabi na sa inyo ang deficiency, even the World Bank. Pagkatapos sinabi mo sa akin noong nakarang araw, aaralin nyo pa lang. You started in 2011. 9 years later, sasabihin mo, Dr. Pargas, aaralin nyo pa lang. What will happen to the fund? What will happen to the fund? Mr. Chair, I will reserve my right for the second round. Thank you very much.